Hi, my name is Carissa Doherty. I'm a naturopathic doctor from the Natural Care Clinic. I'm here to talk a little bit about blood sugar. So with blood sugar, we have to look at a couple different markers to see what the story in the cardiovascular system is doing. So we want to look at fasting blood glucose. The optimum range for fasting blood glucose would be under 5.2. And then we look at HbA1c. HbA1c is our long-term sugar marker. It's developed over time and it's quite inflammatory. So we want that number to be as low as possible. We want that number to also be under 5.2. But when we're looking at fasting blood glucose and HbA1c, we actually want them to be tight. We want them to be very close to the same reference range because there's a flow issue. So a little piece of glucose here in the cardiovascular system has two options. It can jump into insulin and it can go into the cell and give you energy. That's the good direction. Or it can bind to a red blood cell and make HbA1c, which is bad and inflammatory, and cut the cardiovascular system. So we want the sugar to go into the cell, and that's the predominant way. And on a bad day, you're going to build up the HbA1c, that's bad. So we want the numbers to be as close to possible. If this is a 4.8 and this is a 4.8, amazing. If this is a 4.5 and this is a 5.2, that spread is not so good. Although the fasting glucose is good and nice and low, some of it's going a little bit in the bad direction. So the last number is fasting insulin, and the reference range is 20 to 180. Optimum is mid-range. You always want that taxi to be able to take the fasting glucose or take any glucose into the promised land of the cell to give you energy. So when we're looking at glucose, we don't want to look at one marker. We want to look at the flow so we can see the flow of the cardiovascular system. And when we build up with those inflammatory markers, what do? We can look at other markers to see if there's other drama in the cardiovascular system, but this is just a bit of the fasting glucose. We can look at one number, but it's better to look at a couple of numbers when we want to see the picture. Thank you very much. Have a good day.